The OCTA Research team says that ICU bed occupancy remains high despite a downward trend in the number of COVID-19 cases. Dr. Jose de Grano, president of the Private Hospitals Association of the Philippines, or PHAPi, is here to help us make further sense of that. Good afternoon, Doc. Dr. de Grano, OCTA says that the reason for a high ICU bed occupancy is because those that are in the ICU are generally in the hospital longer. Are there other factors that we can attribute to this high occupancy rate?
The reason there is, of course, the patients at the intensive care unit usually stay there for more than a month, maybe 2 months. And of course, in the bigger hospitals, they did not actually increase the number of ICU beds. As far as I know, only the government facilities were able to increase or expand their ICU beds, but not the big hospitals, because it's not easy to expand the ICU facilities because you'll be needing, aside from the staff, additional equipment which are not easy to get. No.
That's right. But is there any plan to increase ICU bed capacity, seeing that it's been a year already, Dr. de Grano, that we've been under the pandemic, and it seems like, every now and then there is a new strain or there is an outbreak. Are there plans among private hospitals to expand bed occupancy rates, as well as, of course, what this also entails, like extra healthcare workers and equipment?
Yes, it should be easy if you think about it, but the problem is it takes a lot of investment, aside from the number of staff that is really needed, because the nursing staff there is 1:1 or even 2:1, so it's not really easy to expand the intensive care units.
But overall, Dr. Grano, I just want to know, in terms of private hospitals, has the occupancy rates in general gone down since last month?
Yes, I think it has gone down by around at least around 10% by since last month. But they are the cases which are more of the moderate cases or moderate to severe cases.
Going down by 10% within the last month, with ECQ or MECQ rather imposed in different forms, of course. Doc, is that enough for the healthcare system to not to be unburdened enough?
We need to have the continuous downtrend, and if that will continually go down, then probably that would be okay. But we still are having still more or less a plateau. It's still on around 6,000 to 7,000 cases per day. So, it has not really gone down very low or continuously gone down.
Having said that, you're in favor of this MECQ flex extension until the middle of the month, I'm guessing?
Yes, sure. I think that should be proper. And even after until the end of the month, but of course that's for them to decide.
All right, now let's shift over the conversation to variants. We have this new variant from India that everyone around the world is watching closely. So what do we know so far about the Indian variant of COVID-19?
Well, what they say is really very infectious, So I think we should really be prepared for that. Because what I know, I don't know, but this is not really based on facts yet. But they say that it's really very virulent, and that's why a lot of people has died in India.
All right, so something definitely that we should monitor closely. Now, do you also agree?
We should.
Yeah, with the vaccine czar's move to prioritize the NCR as well as other high-risk areas for vaccination, does that sound like a good plan to you, sir?
Well, of course, because NCR has the highest number of cases, and of course, if you want to kill the snake, then you have to hit it on the head. So, NCR, Calabarzon, and then Region 3, they have the very high number of cases, so we should concentrate especially at the NCR.
And finally, Dr. De Grano, the president finally received his jab. He received the Sinopharm jab. Do you think this is good news in terms of vaccine confidence?
Well, I think it is. If they see that our president has undergone the vaccination, then probably, all his followers will then be convinced, if they are not convinced yet, to get the vaccine.
All right, and in general, have you observed like an improvement in terms of vaccine confidence, within hospitals? Yeah.
Probably not yet. We'll see in the next coming week. Okay.
All right, we'll see, I guess, when the majority of the vaccines get here. Thank you, as usual, for your time.
Yeah.
Dr. Jose De Grano of the Private Hospitals Association of the Philippines, or PHAPi.